Hi, I'm Alex Howard, and welcome to this video where I really wanted just to talk you through these changes that are going to be happening at the Optimum Health Clinic, which I'm aware we've been trailing as the biggest announcement in the history of the Optimum Health Clinic, which in a sense it is. And really in this video what I want to do is just give you a bit of a whistle-stop tour of what these changes are and really why we're making them. And hopefully what it will do is encourage you to read the documents which we put to support this video, primarily the strategic plan document, which will give you hopefully a fairly clear idea of our plans for the organisation over the coming years. And there's also an open letter from me talking about, from a personal perspective, why I've decided to make these changes. There's also a press release, so if you're involved in a local ME chronic fatigue group, then we'd be grateful if you would forward it on to them and kind of help spread the news of this. So really the headline of the news is that we are going to be transitioning in such a way. So the Optimum Health Clinic, which at the moment, as I'm sure you're aware, is a private organisation owned by myself, we're going to be transitioning so the Optimum Health Clinic is actually owned by our registered charity, the Optimum Health Clinic Foundation. This is possible because of a significant philanthropical donation that was given to me towards the end of last year, which made it possible for me to return the funds from private investors, which had been used over the years to support the development and the growth of the organisation, and effectively put the organisation in a position where I, as sole shareholder, could effectively make this philanthropical gesture of my own. And really the reason behind why I've decided to do this is my vision for the Optimum Health Clinic, and the vision shared by the people that work in the organisation, has always been that the treatments that we have pioneered should be available to everyone that needs them. In the same way that if someone has a heart attack or someone is suffering from something like cancer or MS, that they can go to the NHS and the NHS can provide services, they can provide support. And I'm sure you'll agree that there is a great lack of quality support services for ME chronic fatigue. And there's lots of reasons why that's the case. I'm not going to go into that here. And I've always felt that the treatments that we offer should be available in that context. The trouble is that, of course, we work in a very different way. We have a different therapeutic model, and training up NHS practitioners to do what we do just never seemed like a way that would work. I've been following over the last few years very closely the planned changes to the NHS, where effectively there's I guess you could call it a semi-privatisation, where it is possible for external providers to provide services that will then be funded by NHS funding. And that's where ultimately I believe OHC should be. It should be in a position that we can receive NHS funding to provide the treatments that we offer. And so you can go to your GP effectively and get a referral and get funding. So that whole possibility is opened up. The key thing that we need now at this point is we need a clear evidence base to demonstrate the effectiveness of the OHC approach. And this is what we've been working on for the last couple of years. And the study we have published in the British Medical Journal Open back in November was a stepping stone towards that. That was a preliminary prospective study. What we now want to do is a full randomized controlled trial in an NHS setting. So effectively to work with NHS patients using the OHC approach with OHC practitioners and to collect the evidence on that to demonstrate the effectiveness of the OHC approach. And that's an expensive process. And I'd been thinking, well, would I be able to get funding to do that from private investors again? But the difficulty of doing that, of course, is private investors, they want to have a return on their investment. And I've been very lucky with investors to this point that I've managed to keep the investment at a low enough level that it's been possible for me to have freedom to effectively run the organisation as a social enterprise. What I realised is my reason for having OHC as a private business is historically it made it possible to get access to funding to do certain things that would have been challenging otherwise. But it's never for me been about owning OHC. It's about having the ability to deliver what we want to deliver. And so what I realized was I was effectively in a position that I could make this gesture, and by the Optimum Health Clinic being owned by the Optimum Health Clinic Foundation, so effectively being owned by a charity, what it therefore means is we can start to fundraise through the charity and use that research funding to do the randomized controlled trial on the Optimum Health Clinic. And that will therefore, hopefully, in time mean that we will then be able to develop that evidence base to then be able to start getting NHS funding for treatment. Now, I want to say that this is a strategic plan. There are many details to be worked out, and this will take a period of time. I imagine it will be at least 3 years, and this depends upon how successful we are with fundraising, but it will take around 3 years to do the randomized controlled trial. And I think it will take at least another couple of years after that to start to build relationships in the right ways, build the evidence base, put together the information we need to start to get NHS funding, and then it will be kind of area by area. So it's not like overnight suddenly all this funding is going to become available. This is a strategic plan, and we obviously need support to make this happen. And until that happens, people will still have to pay for treatment exactly as they do. They will be paying for treatment at the same price point because, believe it or not, OHC has never ultimately been run with profit as the primary motivator. So by becoming owned by a charity, it doesn't suddenly mean we can start cutting prices. And any profits that are made by the clinic will directly go into funding research anyway. So really, partly I just wanted to let people know this is happening. Our plan is that we're making the transition from this point. So it should be the case that the trading is running in the subsidiary company within the next kind of 1 to 2 months. So it's a transition towards doing that. And really what we're asking is, if you believe in OHC and if you believe in the kind of vision that we're outlining here, and I really encourage you to read the strategic document because that will give you much more of an idea of our plans, then we would love to have your support. All overheads of the clinic, of the organisation, of course, are covered. So any fundraising we receive, any donations we receive, will go directly into the randomised controlled trial. And we are looking over the next 3 years to raise around £350,000 to do that. Now, that sounds like a big number. And it's, there's been lots of people watching this think, oh my God, that's a huge amount of money. How are they going to raise that? I believe that we can. And, in a sense, I wouldn't have started OHC if I didn't believe it was possible to do very difficult, challenging things. And really, I think the primary place this is going to be made possible is by galvanizing, as it were, OHC's patient group. If everyone that had ever been touched by OHC made a small donation or did some kind of fundraising event, anything from someone that's fully recovered to doing a sponsored bike ride or kind of run or something like that, or someone that's still on a recovery path doing something more simple like baking cakes and selling them. There's many ways you can fundraise. But if everyone that had been touched by OHC did something, then we would raise that money certainly in the timescale that we need to. And that's really what I'm asking. This has been possible by an anonymous person making a significant gesture towards the original organisation, allowing me to make this gesture towards the charity. We now need effectively you to support the next stage. And we'll talk a lot more over the coming months and of course the coming years of updating you where we are, of giving ideas of ways that you can support us. Over time, we're also looking to expand the board of trustees in the Optimum Health Clinic Foundation, be opportunities to volunteer for the Optimum Health Clinic subsidiary companies. So there's going to be lots of ways to get involved over time. But if you believe in what we're talking about here, and hopefully you can see the commitment that's gone in from various people to get to this point and to make it possible, we would love your support. So please do read the strategic plan. If you're interested in more about my personal journey within this, you're welcome to read my open letter expressing some of that. Please do spread the word. And also I want to say thank you to the people that have made this possible. Both people that have worked within the organisation, also our patient group by working with us, kind of sharing with us. That's how we've been able to develop the understandings that we have over the years. So I think that's it for now. Thank you for watching. We'll certainly talk with you more over time. And you know, it's going to be an extraordinary future, and we'd love you to be part of it.